I'm Debbie Bell, and on behalf of the Franklin County Health Department, I'd like to welcome you to Working on Wellness. Today, I have with us two very distinguished guests. First, Dr. Valance with Capital Surgical Clinic, and he is on staff here with the Frankfort Regional Medical Center. And we have Richard Broadus, who is the Director of Respiratory Care at the Frankfort Regional Medical Center. Welcome, both of you, and thank you for being with us today.
Thank you.
Dr. Valance, we're talking a little bit about lung cancer today. Can you give us some ideas as far as what does lung cancer look like in our state of Kentucky, and how does it measure up if you're looking at rates for the entire nation?
Yes, unfortunately, lung cancer is very common, not only in the state of Kentucky, but in the United States and worldwide. In 2010, for example, there were 225,000 of new diagnosed lung cancer cases in the United States. During that same time period in Kentucky, we had approximately 4,600 new cases of lung cancer diagnosed in our state. And that's on a yearly basis, so we're not just talking about an isolated time period. Unfortunately, Kentucky leads the nation in percentage of our patients that develop lung cancer. Compared to the surrounding states, we're number one. Compared to the rest of the United States, we're number one.
Wow. When we talk about lung cancer, you know, unfortunately, it does lead us to question, you know, what is the prognosis for someone that gets lung cancer? And, you know, a little bit later, I'd like to talk about stages with you, but what is the death rate as far as those that would develop lung cancer?
It's abysmal, actually, and lung cancer is the most common cause of cancer death in both men and women in Kentucky, United States, and the world. And when we talk about survival, what's the death rate, et cetera, how likely are you to be alive a year or 5 years later, the survival rate for lung cancer is less than 20% at 5 years. It's the most common, lung cancer is the most common cancer diagnosed in the United States. About 25% of all people that die of cancer die from lung cancer. And that's just astounding when you think about the variety of different cancers we have. 5-year survival, again, about 17% if we compare that to the 5-year survival for a woman with breast cancer. In other words, from the time of diagnosis up through and including 5 years later, how likely are you to be alive? With lung cancer, less than 20%. With breast cancer, about 80%. Even with colon cancer, it's 65%. And most of that is due to the fact that lung cancer is diagnosed very late, at a late stage when it's advanced and already spread and not treatable for the most part.
You know, those numbers are fearful. They're, you know, they're scary to think about. The first thing that comes to mind for me is what's causing this?
Well, the cause of lung cancer is, there are many causes. It's multifactorial, but we should not lose sight of the fact that by far and away the most common cause of lung cancer is cigarette smoking. That's been proven many times again. There's no question, there's no doubt about that. There are other causes of lung cancer. So a person who smokes, if you smoke 2 packs a day, for example, for 20 years, your risk of developing lung cancer is 20 times greater than a non-smoker. 20 times greater, that's just phenomenal. Other common causes of lung cancer are secondhand smoke. You don't have to smoke yourself, but if you live with a spouse who smokes in a house and for a period of number of years, your risk of lung cancer goes up. If you work in an environment, and not so much today, but in office buildings and so forth, every day you go to work, you're exposed to 15, 20 people smoking in an office building, in a restaurant or a bar, that increases your risk of lung cancer. Other factors, environmental factors like exposure to asbestos, especially asbestos in a smoker. Radon, for example, which is a naturally occurring gas in the environment, and if you smoke, that increases your risk. And then there's some people who develop lung cancer who don't have any of those risk factors. About 20% of people that develop lung cancer are non-smokers, but that includes the secondhand smoke, environmental risk factors, and then some people have what we call just bad genetics, inherited factors, family risk factors, that maybe a mother, father, brother, and sister all had lung cancer, maybe smoked, maybe didn't. That increases your risk.
Dr. Dr. Valance, going back, looking at lung cancers, are there different types of lung cancers, and is there a different prognosis attached to those different types?
Yes. We tend to categorize lung cancer more recently in two large categories. And we refer to those as patients who have what's called non-small cell lung cancer, and then those who have what's called small cell lung cancer, which used to be referred to, and some people still talk about it, as oat cell lung cancer. Non-small cell lung cancer is about 85%, is responsible for about 85% of all lung cancers. And in the non-small cell category, there are three primary types. Adenocarcinoma has become more recently the most common type of lung cancer, about 40% of all lung cancers. Squamous cell carcinoma makes up about 35%, and then something called large cell carcinoma is about 10%. And then there are a few others that are too numerous to mention that make up a much smaller percentage. And then in the small cell category, that's about 15% of all lung cancers, and it's a totally different animal. Most people with small cell lung cancers have very aggressive tumors. By the time we diagnose them, almost all of them are metastatic. In other words, they've spread to other sites of the body outside the chest, and they're not candidates for surgery. Prognosis is very poor for small cell lung cancer. Less than 5% of people with small cell lung cancer are going to be alive 5 years later. However, small cell lung cancer sort of have a unique feature. They respond very well to radiation and chemo. And sometimes they appear to go into remission, but they're very seldom cured. So when we talk about survival, then overall, non-small cell lung cancer is just a terrible survival chance. The other types of lung cancer depends on, which we haven't necessarily discussed yet, but it depends on the stage. So you have different stages of lung cancer, which most cancers are staged similarly, 1 through 4. So in lung cancer, it's 1, 2, 3, 4. Stage 1 lung cancers are very small tumors when they're found, and they usually do not involve any lymph nodes in the chest, and they haven't spread anywhere. If those people have a resection, which most people can, the survival rate for stage 1 lung cancer after surgery is about 60 to 80% at 5 years. That includes sometimes other treatments as well. For stage 2, a little bit larger tumors, lymph nodes inside the lung may be involved, so it's a little more advanced. 5-year survival is about 40 to 60% with surgery. Stage 3 tumors, bigger tumors, may be invading structures inside the chest, lymph nodes in the middle of the chest or elsewhere. Survival rate goes down significantly to about 25% at 5 years. And in people with stage 4 lung cancer, which is metastatic cancer that's spread to most common sites are liver, bone, brain, adrenal glands, survival rates less than 5% at 5 years, regardless of treatment.
Okay. When you start talking about stages, and and I know that can vary with different types of cancer, to me it speaks to the urgency of being screened so that you can catch these cancers early. Can you talk a little bit about the screening process as far as lung cancer is concerned, and maybe the importance of if you feel there might be a problem, what are they looking for?
Well, screening is sort of an age-old question in lung cancer. Again, the 5-year survival rate is so terrible that the question's always been, how can we improve that? And as Richard was alluding to, the best way to improve the survival of lung cancer is not to get it in the first place, and the best way not to get it in the first place is do not start smoking, and if you smoke, stop smoking. And then 80% of people are not going to have lung cancer that currently have it. But having said that, we have a lot of people in the state of Kentucky, like Richard said, 29% of our population, which is better than it was 10 years ago, but almost a third of our population smokes. So what we want to know is there some way in smokers or high-risk individuals who are smokers or former smokers or secondhand smoke or exposed to significant environmental factors or high chance of getting lung cancer secondary to genetics, is there some way we could find those cancers earlier, when they're smaller, they haven't metastasized, and if we can remove them, can we improve the cure rate? And for years, physicians and researchers have been trying to determine how to do that. Nothing up until recently has shown any significant advantage. There are several good studies now showing that if we take those patients and screen them. And the way we screen them is we do a CAT scan of the chest. 5 years from now, 10 years from now, it may be something else. It may be genetic testing, etc. But if you screen those people with a CAT scan of the chest, and then every year for 5 years you continue to follow up and get a CAT scan, what you find is that you find tumors in a certain percentage of high-risk people at a small size, an early stage, and if you take those people to the operating room and remove their tumor, you can improve the survival rate by approximately 20%. That's dramatic. I mean, that is just better than anything we've seen thus far. So a few places around the country now are starting to offer screening programs for high-risk patients. We've considered that here in Frankfort, and we're having an ongoing discussion about it at the present time. We're not offering that as a formal program, but anybody could come in and obviously get a screening exam if they chose to do so.
You know, looking at the social norms, you know, what is acceptable now? And you know, we had talked a little bit about ordinances. We are both a smoke-free city of Frankfort and a smoke-free, as of 2012, county.
I think one thing we have to focus on, though, again, remember, and those things are extremely important, but that's secondhand smoke. Remember, 80% of all lung cancers occur in smokers. I mean, you just can't get away from that fact. So people have to understand that if they want to decrease their personal risk of lung cancer, they have to be responsible for their own behavior. And so we can do all kinds of things, but you cannot force people to stop smoking. You can make it harder for them to smoke, you can make it more expensive, you can tax it, which helps. You can try to prevent teenagers from starting smoking, peer pressure, etc. But you have to take it up on yourself to understand that this is an unbelievable risk factor. For years, cigarette companies and everybody else lied to people and told them that it didn't increase the risk. And so you couldn't blame people 25, 30, 40 years ago for smoking. They didn't think it impacted their health. But we know that now. And there are still people in our state and our country and worldwide who do not believe that. It's a conspiracy or it's something else. And I have a very little sympathy for those people because the scientific fact is indisputable. So if you continue to smoke and you get lung cancer, then you did it to yourself. Now that may sound cruel, and we don't mean for it to be cruel, but I think you have to get the point across. People have to understand, if you smoke, your chances of getting lung cancer are anywhere from 10 to 20 times greater than a non-smoker. And, as Richard and you all pointed out, you're exposing your friends and family and other people to that risk as well if you smoke in their environment.
Those are excellent points, and I do appreciate you stressing the importance behind that. One more question that I had is, who do you feel, Dr. Valance, needs to be screened? Everybody that smokes?
No, and there's a very strict set of current criteria for screening. Now that's subject to change, but it's based on the research that's been done up to this point. Smokers. And not somebody, I had a patient in the office yesterday who has a lung cancer. She smoked 7 cigarettes a day for a year. That's probably of no significance, and that was 50 years ago. People who currently smoke, and we're not talking about people necessarily that smoke 1 cigarette a weekend when they're out with their friends, but a routine smoker, even less than a pack a day, who has been smoking for several years. So smokers and smokers who have quit smoking, who smoked a significant number of years. And then those other people that we mentioned have a significant family history of lung cancer, they have a significant exposure to asbestos perhaps in the past, and they smoked, and they've lived in an environment where they were exposed to a lot of radon or extremely polluted environment in a factory or in a city that's filled with smog all the time, and they also smoked. So sort of a broad category of patients, but primarily smokers or ex-smokers. And what the studies have shown is that we know there's a lag time. It takes 20 to 25 years from the time you became a significant smoker to really develop a significant risk for developing lung cancer. So current recommendations are, if you're a smoker or a significant ex-smoker, we start screening you at age 55. And then maybe up to age 75. Of course, that costs money, so you have to justify that as well, and somebody has to pay for that. Do people in their 30s or 40s get